Good afternoon, everybody. I hope you all had a good Easter break. Growing our health workforce and addressing long-standing health workforce pressures has been a priority for the government. We're making much-needed changes to the way our health system is set up and operates, and it's vital that we've got sufficient qualified people to deliver our recorded health investments and improve access to quality healthcare for New Zealanders. Since we've been in government, we've made significant progress in growing the number of doctors and nurses in our workforce. We're doubling the number of funded places on the nurse practitioner training program to 100 places and increasing the number of GPs being trained a year to 300, and that's due to kick in by 2026. The scheme to bond rural health professionals is showing success with more than 500 applicants since last year. And we've got a record number of Hauora Māori scholarships with 756 people in professional health training. But despite this progress that we've been making and the strong focus that we've had on pay equity and lifting incomes for health workers across the board, we acknowledge more needs to be done, and that does include attracting more skills from overseas. We know that the world is currently facing a global health worker shortage, so it is vital that New Zealand's immigration settings are not seen as an unnecessary barrier to health workers wanting to make a life here in New Zealand. We've been working hard to tip the balance further our way. Last December, the government signalled we would take a wider approach to the green list for the health sector, and since then the Minister of Health has extensively canvassed the views of the sector. The changes I'm announcing today reflect that feedback. Cabinet has agreed to add 32 new health sector roles to the green list. Cabinet's also agreed that 48 green list health roles, including roles already on the green list, will be on the straight to residence pathway. The new roles include enrolled nurses, nurse practitioners, dentists, dental technicians, MRI scanning technologists, optometrists and pharmacists. They'll join the likes of midwives and registered nurses who will move to the green list straight to residence pathway in December. Since that decision was taken, we've received 3,600 health sector applications, including 1,400 nurses, 200 doctors and other specialists, and 95 GPs. In the same period, we've seen nearly 3,000 health professionals arriving in the country. These settings are highly competitive globally and send a strong signal to health workers internationally that we're serious in rolling out the welcome mat. We know that moving countries is one of the biggest decisions anyone can make in their lives and in the lives of their families. With these changes, the aim is to provide additional certainty when they're making those decisions that they'll be able to create a permanent home and a great life here in New Zealand. And we're moving quickly. While it's clear that the news will take time to spread, the changes will start to apply in just 7 weeks' time from the 29th of May. I can also announce today some further changes to immigration settings to help ease pressure in the transport sector. In a similar way to decisions last December when international bus and truck drivers were offered a time-limited residence pathway through an agreement with the transport sector, boat skippers and deckhands are also being added to that agreement. Our seaside cities' ferries form an essential part of the public transport system, so it's critical that ferry service operators have access to the workers to enhance the reliability of these services. This was highlighted most recently with the coastal shipping providing an important lifeline to the East Coast regions affected by Cyclone Gabrielle. They're critical to help keep supply lines running. The market rate for skippers is already above the median wage. Operators will need to continue to pay migrant worker skippers the market rate, and migrant worker deckhands will need to be paid at least the median wage. Over the coming weeks, immigration will be working with the sector to finalise the details with the same expectation that the scheme will start from late May. Finally, today in other news, I can announce a minor reshuffle of the Cabinet. Willow Jean Prime will be joining the Cabinet, meaning for the first time in New Zealand's history, half of the people sitting around the Cabinet table will be women. The economic development portfolio will be picked up by Barbara Edmonds. And the forestry portfolio will be picked up by Penny Hinari. Meka Whaitari will continue in her role coordinating the cyclone recovery efforts on the Hawke's Bay. I'm also pleased to announce that I intend to appoint Rachel Brooking as a minister outside of the Cabinet. She'll pick up the Oceans and Fisheries portfolio and associate roles in environment and in immigration. Now, happy to open up for questions.
What's taking you so long to make those immigration changes? Why are we so slow to the game every single time you try and make an immigration change?
We foreshadowed these decisions back in December. We've worked through a process with the sector to identify the roles where they most need the additional support and where this extra pathway can be the most useful, bearing in mind that a number of jobs can already come into the country through other pathways that are already available and have been for some time.
The health workers shortage has not blindsided you as of yesterday. This has been going on for a long time now. What has taken you so long?
And look, we've continued to keep it under review, and you will have seen over the last year that we've continued to make changes.
So what's your view of the ads promoting online sports betting? There's been a bit of problems with that.
Yeah, ultimately those are a matter for the regulatory agencies to look into. We've got some clear laws around what they can and can't do, and so ultimately the regulatory agencies will need to follow up on that.
Do you think that the consumers need more protections against misleading ads, for example?
I wouldn't rule out more work in that space. We know that the world has changed, and the whole issue of online gambling has changed significantly, and that is something where we will need to make sure our regulatory settings are moving to keep up with that.
You considered the COVID settings today. Are they staying the same, or are you going to change them?
Oh, sorry, I didn't cover that one in my announcement. Yes, indeed. So the COVID-19 settings will remain the same for the next 2 months, and then we will consider them again within the next 2 months, and further decisions will follow on that. We've asked specifically for further advice on the issue of testing to return to work, so people may not need to isolate for that full period. We'll consider that with the next round of potential changes.
Why are they staying the same?
Look, it's a difficult balancing act, and I do want to acknowledge that we've had to weigh a number of things quite carefully. At the moment, the isolation period serves not just to relieve pressure on the health system and result in fewer people being infected, but actually there is a labour market incentive for this as well. People with COVID-19 going to work potentially infect more people, and more people end up being off work sick as well. We see that in some sectors particularly. So if we look at some of the biggest pressure that we faced in the education system last year, that resulted in a number of teachers getting COVID-19, being off work, some schools not able then to offer their full range of classes, kids being rostered home, and parents having to stay home to look after them. So we have to weigh up all of those factors in making these decisions.